Our spines are amazing structures, providing support and flexibility. Take a look at the neck, the cervical spine. From the side, see a gentle inward curve. That's called cervical lordosis. This natural curve helps us hold our heads high, absorb shock, and move our necks freely. Think of it like a spring, perfectly designed to balance our heads. Now imagine that spring losing its shape. That's what happens when the cervical lordosis is reduced or lost. Instead of a gentle curve, the neck may appear straight or even curved outward. This change can lead to stiffness, pain, and difficulty moving the neck comfortably. Several factors can impact cervical lordosis, including poor posture, injuries, and underlying medical conditions. Slouching over computers and phones, for instance, can gradually alter the natural curve of our necks. Understanding cervical lordosis is key to understanding many spinal issues, including a common problem known as cervical disc herniation. Between each vertebra in our spine, there are these little cushions called intervertebral discs. These discs are like shock absorbers, allowing for movement and cushioning the vertebrae. They have a tough outer layer and a soft, jelly-like center. Imagine one of these discs getting squished or damaged. That's essentially what happens in a cervical disc herniation. The soft center pushes through the outer layer, potentially irritating nearby nerves. This herniation can happen for various reasons, like wear and tear over time, sudden injuries, or repetitive strain. Symptoms can range from mild neck pain to more serious issues like numbness, tingling, or weakness in the arms and hands, depending on the location and severity of the herniation. While I can't speak to the specific findings of the study you mentioned due to the lack of accessible information, research often explores a potential connection between cervical lordosis and disc herniation. Some studies suggest that changes in the cervical lordosis, particularly a straightening or reversal of the curve, might increase the risk of disc herniation. The reasoning is that an altered curve could put uneven pressure on the discs, making them more susceptible to damage over time. These studies often involve analyzing medical imaging, like X-rays or MRIs, of patients with and without disc herniation, looking for patterns and correlations. Understanding the potential link between cervical lordosis and disc herniation is particularly important for young patients. Why? Because early detection and intervention are key to preventing long-term complications. If research shows a strong correlation, it emphasizes the importance of maintaining good posture, especially in our digital age. Encouraging young people to be mindful of their posture while using phones and computers could potentially reduce the risk of developing these spinal issues later on. Further research is always valuable in this field. The more we understand about these conditions and their relationship, the better equipped we are to diagnose, treat, and hopefully prevent them in the future.